Okay, here's our video today. What a pulled muscle means. What does it mean when you pull a muscle? And there's different stages of what a pulled muscle could be. And basically, a pulled muscle means that the muscle fibers that you can see in the picture, the muscle fibers are overstretched or they're torn. And so you can say a pulled muscle is a muscle strain. And so we should say that a muscle strain. And again, the muscle fibers, the fibers are overstretched. Or torn, depending on the stage, which we'll talk about. Now, some tears, they're micro tears. I'll say micro. You can't see them because they're micro, right? Micro tears are not visible. And that's usually the stage or the grade of a grade 1. But there are other grades or stages where you can see them. So let's talk about that. So there's 3 grades, and we'll say the 3 grades, or stages, you can say 3 grades or 3 stages. Stage or grade 1 is what we call mild, and these are normally micro tears. Can't see them. And here, again, since it's mild, it'd be mild pain. And some swelling, maybe some swelling, put down. Or not. You may not see the swelling. And we're looking at days. It could last a day or 2 days or more. That's what mild means. Again, there are stages within these grades too. And a stage, or grade 2, which will say moderate. Now here you'll find more pain, right? So there'll be bruising. There'll be pain, obviously. And this type of pull could last weeks. And the 3, grade 3, this is severe. Now keep in mind there are classes within these 3 grades. And severe, of course, just like it says, severe pain. Now, with this type of grade, sometimes surgery is needed. So, and we're looking at months for recovery on here, if not years, perhaps, depending on the grade. So, for the most part, general population, or on a daily basis, some people might find this grade 1 of a mild pain. You just look the wrong way, you try to lift the window open or something, and you get this pull, and within a couple of days it goes away. So when this happens, the body is going to initiate an inflammatory response. It's going to try to fix it. Of course, that's what we want to happen. So let's look at the inflammatory response. By the way, here's the grades. As you can see, you can guess which is grade 3. What do you think? I'm looking for my pen. All right, so here's grade 1, mild, micro tears. Grade 2, grade 3. Look at this. This is a beyond an ouch when you get grade 3. So if we're looking at the 3 stages that your body will try to fix the problem. So again, the body will initiate. Don't forget to dot your I's. An inflammatory response. In other words, we're going to fix the problem. Well, not we, but our body. And so what happens is the blood vessels, will dilate. They'll get wide. They'll become widened. And the reason for that is for increased blood flow. So you need increased blood flow to bring in those nutrients and those white blood cells. So that's what it wants. It's going to increase blood flow. By the way, that's an E, not an A, an E. Vessels, in case you're an English teacher out there. So again, the body's going to initiate an inflammatory response. Blood vessels will dilate, they'll widen, so we can get increased blood flow, so we can bring in those white blood cells and nutrients. And let's talk about those nutrients. Let's do it on this side. We'll even change the color. Maybe a little darker. Maybe we'll use blue. So the white blood cells that we want, you can see in the diagram, we'll go over it. The white blood cells, first responders, right? We have the neutrophils. And they're the most common white blood cell. And they'll fight the infection if there is any infection. They'll also, the neutrophils will clear any debris that may happen from a torn muscle. So they clear the debris, look for any infection that may happen in here. And over here you see the muscle cell debris, this stuff over here. Got to clear it out. And there's the neutrophils. Neutrophils to the rescue. Clear that out. There's also macrophages, which, and again, these are all white blood cells. A macrophage, they'll eat it. They'll eat all the dead cells. They'll eat all the dead neutrophils. Once the neutrophils clear the debris by eating it, the macrophages will eat the dead cells. So we'll just say they're like the vacuum cleaners. They eat the dead cells. Come in and just eat them up. And then we have the lymphocytes. Again, all white blood cells. The lymphocytes, they're going to produce antibodies. To neutralize any infections. So neutrophils will eat the infection, and the lymphocytes will produce antibodies in case there's more infections like viruses or bacteria that come in later into the scene. Now also we need nutrients coming in, especially proteins. And why do you think we need proteins? We need proteins because proteins build muscle, and we have to build that muscle back up, especially plasma proteins. So we need these, we'll change the color again. Plasma proteins from the blood, plasma proteins, to help build up the muscles. All right, so let's look at these stages again. So the first stage, we have the white blood cells, as you can see, going in, also with the macrophages, clean up the debris, eat the debris, and so forth like that. And now it's time to restore the torn muscle, and we'll see the highlights here. You see this thing over here, that is a fibroblast. Sounds fancy, fibroblasts. And they're going to produce collagen. They're going to produce collagen, which you need to form new tissue. So you can see them there. They'll start forming that collagen. There's also something called MU, capital S, capital C. And what these things do is they're going to replace damaged tissue. Start replacing. And you can see them here in green. They're all over the place replacing. They're getting to work to replace the damaged tissue, to put in new tissue with the help of the fibroblasts. So the fibroblasts and these muscle stem cells, that's what the MUSC, muscle stem cells, they will start repairing this. They'll be the construction workers. So again, inflammatory response, increased blood flow. You can see in stage 1, first stage that the neutrophils and macrophages are clearing the debris, killing any pathogens. And in the restorative phase, we can see the muscle stem cells. They'll make new tissue with the help of the fibroblasts, not fiberglass. And this collagen, think of collagen as like cement. And so as the fibroblasts put in this new cement, this new tissue, the MUSC, the muscle stem cells, are kind of like the mason workers that lay down that foundation. All right, and that's our video today.